We came late today. I'm just going to wait and see those that are online. So I think I'm just going to get a pen. I'm getting my daughter keep the box of pen. So I'm just going to get a pen quickly. Yep. So I'm going to get a pen. I'm going to get a pen. So while waiting, let's see. This is my daughter's box of pen. So just in case, because my body's not close by today. So I'm likely going to use this paper and pencil. Hello, Wise Madine. How are you doing? Welcome to today's live. How are you all doing? Thank you for joining us, Wise Madine. I came late today. Sorry, everyone. So let's just wait for others to join. I am a late comer today. I believe I am allowed to be late. Okay? I'm allowed to be late, right? Wise Madine is watching from Malawi. Claudine Otoy Jagali. How are you doing, Claudine? Trust you're doing great. It's nice having you on my live today. Thank you for joining. Let's see. So while we are waiting, I'm going to do a mini calendar on this paper here because that's going to make me easily calculate the cycle. So we are going to be doing a mini calendar for April, May, June, July. So if you are watching, just drop on the comment section and let me know where you are actually watching us from. And if this is the first time of coming across this beautiful face, my name is Mercy Mary. I am a registered nurse midwife in Nigeria, but I'm currently practicing in the UK as a registered adult nurse. Feel free to drop your questions in the comment section. I am willing and ready to take them today as usual. So I actually promised people that I was going to be live between 9 to 10, but I could not make it by 9 because I had something to do, and it's 10 p.m. right now. It's past 10 already, and I am 10 minutes late past 10. Hopefully they are not sleeping and hopefully they pop in. So if you have any question, feel free to drop on the comment section while I make my special calendar. Claudine is watching from Edo State. Nice having you here. So if you have any question, I'm making the calendar now. If you have those that we have a lot of people asking for us to calculate their cycle in our last live yesterday, but I could not meet up. I spent more than 1 hour 30 minutes calculating cycle last night. I had to end the video last night because I was so tired, and I told them to come over today. And today I am a little bit late, so hopefully they are here. So if you want us to calculate your cycle, drop on the comment section. I will be willing and ready to answer that questions today. So I think I have a lot of time today compared to yesterday. So hello, Bethel, Osemudia, man. How are you doing? Trust you are doing great. Hello, Robin. Robin, how are you doing? Trust you are all doing great. Robin, how are you doing? So I'm making my calendar. Feel free to drop. If you want me to calculate your cycle, drop on the comment section. Robin, I'm fine. It's nice having you on our live today. Hello, Aina. How are you doing? Trust you're doing great. Aina, how are you doing? Where are you watching us from? Thank you for all the likes. All you have to do is to double tap the screen and it automatically likes the video. So for those that are wondering what I'm doing, I'm trying to get a mini calendar here because I could not bring that board down here. Yes, because it's of no use most times when I bring the board. So that's why I'm just doing the calendar here. So Betty said, what about if the period starts coming out little? Should we count? Yes, the first day you see the blood is the first day, like is the day one. Even if it's very little, it's very small, that is the day one. Okay, the first day you saw that blood is the day one. Aina is from Lagos State. Nice having you. I am Aiman. Aina. Then we have Ree Rembrandt from Greece. Greetings from Greece. Hello, Ree Rembrandt. It's nice having you on our lives. Then Robin said Robin is from Pennsylvania, USA. Thank you very much for joining our live. So we are, like I earlier said, if this is the first time of coming across this channel, my name is Mercy Mary. I am a registered nurse midwife in Nigeria, but in UK, I'm practicing as a registered adult nurse. So on this channel, we talk about health, more of fertility, more of sexual and reproductive health. So if you have any question, feel free to drop on the comment sections. And if you want us to calculate your cycle as a lady, to know your menstrual cycle, to know your safe and your unsafe period, just let us know on the comment section, and I will be willing and ready to answer that. So any question on the comment section. All right. So I'm making the calendar. I'm making the calendar now, so I can make it so it's easy for us to calculate your cycle for you. Let us know where you are watching us from in the comment section. 6, 7, 8, 9, 10, 11, 12, 13, 14. Let us know where you are watching us from in the comment section, please. Before we get going, before we get busy. I need more questions like yesterday. Yesterday was super interesting because we have a lot, like tons of questions. 17, 18, 19, 20. So we need more questions today. Yesterday, I started running from questions. So today, let me run from question today. 26, 27, 28, 29, 30. So this is April, May, June, July. So we have a question from Robin. Robin said, I've had cancer for 18 years, on and off 5 different times, and because of chemo, I stopped getting my period until about a year ago. I believe your question is not complete, Robin. So I will just wait for you to complete your question. So Pluto Cycle said, hello Pluto Cycle, how are you doing? Claudine said, what about those who have irregular cycle? How do they know how to calculate their cycle? For theirs, it's a bit skeptical, yes, but you have to find out the reason why your cycle is irregular. And when you say irregular cycle, what do you mean? Does it mean your cycle is like every 40 days, every 50 days, like 2 months you're not going to see your period, or 3 months you're not going to see your period? What do you mean when you say you are having irregular flow or irregular cycle? I would like to know about that in the comment section. So we have Mrs. Classic Mayor. Hi, from Abuja, Nigeria. It's okay having you here. Then Robin said, is that normal? Yes, Robin, it is normal. Generally, medications can alter your cycle. Medications can alter your cycle. So I believe this stoppage, the period stopped because of the chemo you are on, or the chemotherapies you are on. So if you are concerned or bothered about it, you can actually visit the doctor just to be sure that it's as a result of the chemo or something else, just for them to pinpoint, okay, what is really happening. But it is possible for your periods to stop because of chemo treatment, because generally medications alter your cycle, medications alter your measures, so it is okay. So what I would advise you to do is to see the doctor just for proper checkup and advice personally from them, especially from your oncologist and people. So Bethel, please pray for me. Bethel, pray for you in regards to what are you trying to conceive? I would like to know. Are you trying to conceive, Bethel? So Robin is better. Let me know. Okay, let's see. Robin said, will it affect me? Yes, it can. It can affect your menopause generally because chemotherapy it's another thing on its own. So it can affect your menopause, it can affect your menses, it can affect your period, it can affect your ovulation because chemotherapy is a whole lot. It's a whole lot. So yeah, it can. So Bette said, please pray for me. I'm a little bit scared. I have heteroscopy to do by September. Okay, we wish you all the best, Bette. It's not like a scary procedure. It's just it's a very easy procedure. So just take your mind, stay positive, and see how it go with the hysteroscopy. All right, Bette. I wish you all the very best and congratulations in advance. That's what I have to say personally, Bette. All right. Good evening, precious gifts. How are you doing? Robbie said, thank you. Have a wonderful day. You're welcome, Robin. It's nice having you on the live. Feel free to drop your questions and I will be willing to answer it. So Betta said, thank you very much. You're welcome. So for those that asked me to calculate their cycle, I'm still waiting for you. I think I've answered all the questions in the comment section now. If there's more questions, I am willing and ready to take them. That's why I'm here today. All right. So let's keep the question coming. 30 days has September, April, June, and November. So May is 31 days. April, June, and November. I think July is 31 days. 30 days are September, April, June, and November. All the rest are 31st. So August is also 31st. Yep. August is 31st. So let me, okay, where's my phone? I just want to check how many days just to be sure in each month calendar. So we have April is 30 days, May is 31 days, June is 30 days, July is 31 days, August is 31 days. Okay. We have a question. I think we have a question. So we have a question from Kolo Mary. Kolo Mary said, what is your take on PID? If you have pelvic inflammatory disease, my take is see the doctor as soon as possible, get it treated. Yes. Because if you get PID and it's not treated properly, it can actually lead to the scarring of your fallopian tube. It can lead to scar there. It can lead to scars in your reproductive system. So PID simply means pelvic inflammatory disease. And most times the doctors give antibiotics to get it treated because it's an infection, usually bacteria. They give antibiotics to get it treated. So if you have PID, visit the doctor, follow the prescription swiftly. Don't miss your prescription. Don't miss any dosage and get it sorted out. That's what I have to say in regards to PID, Colomary, and I believe that helps you. So we have Aina said, please work on my cycle. Period starts on the 4th of July and I have 28 days cycle. What do you really want me to work on when you say work on my cycle? You already know that you have 28 days cycle and your period started on the 4th of July. So what exactly is, when you say work on my cycle, Aina, what do you mean? What do you mean? I would like to know, Aina, if you hear me, what do you mean when you say work on my cycle? Aina, are you answer? Let me finish with Aina, then I will go to Bethel. So Aina, when you say work on my cycle, what do you mean? I want to know my safe. Okay, you are sure you have where is Aina? You are sure you have 20, let's assume you are sure you have 28 days cycle. So if you have 28 days cycle, if you have 20 days 8 days cycle, your ovulation is going to be day 14. So let's find out your ovulation now. So you said you started your period on the 4th of July. So 4th of July is going to be your day 1. 4th of July is going to be your day 1. So we're going to calculate 14 days from 4th of July. So we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. From what we calculate, on the 27th is your fertile, like is your ovulation day. On the 27th, Aina, is your ovulation day. On the 27th is your ovulation day, Aina, is the day you are going to release egg on the 27th of July. So in this month of July, on the 27th is when you are going to release egg. During that 27th of July, if you have sex, there's an increased chance you are going to get pregnant. So in terms of your fertile days, from let's say from 23 is not safe. From 23 of July, it's not safe for you to have sex. Till let's say 29, from 23 to 29, generally I will tell you, if you don't want to get pregnant, don't have sex during that period, to be on the safer side, because ovulation day is usually plus or minus 2. So 27 days plus or minus 2. And we all know that when you have sex and there is sperm inside of you, that sperm lasts for up to like 5-7 days. So 5-7 days before your ovulation is not safe. 5-7 days before you release egg is usually not safe, because the sperm is going to stay in your body for that duration. So that is why personally I advise 7 days, not even 5. Don't risk it. 7 days before your ovulation, don't have sex. Don't have anything to do with, like, or have sex, but use protection or anyone you want to use. But if you are trying to conceive, this is the period you should have frequent, regular sex. So I believe I've been able to answer Aina's question. Hopefully, Aina, you understand what I mean. So we have a lot of questions today. I'm happy. So what I would advise you to do is to just stay tuned till it gets to your turn, because I don't want to be answering this question over and over again. So I just finished Aina's question. So I'm going to go to I'm treating it one after the other. So Bette said, what causes blood clots during period? Blood clots during period is more or less like, it's normal. Is a normal sign of a heavy period. For those that are experiencing heavy period, blood clot is a sign that, oh, you're having heavy period. It's usually nothing of concern. Okay, it's just your endometrium that is shedding at that particular moment. So if it's not very, very big, it's very large, it's not like minute. If the blood clot is small, it's not a problem. But if the blood clot becomes big, then it's something you should consider seeing the doctor to get it checked out. But if you're having just little blood clots in your pad, then it's something you should not be worried about. So Colomary said, I just treated milky discharge from the breast. Any advice? First of all, what I would ask you is, what were they treating you for? Was it hormonal imbalance you were getting treated for? And if you are getting treated for breast discharge, find out what they exactly are they treating you for. And in summary, after you have treated it, it is very, very important for you to eat healthy. Eating healthy is one of the way your body regulates itself. So when you eat healthy, it helps balances hormone, it helps put things in place. So that's what I have to say in regards to that. And I hope that question has been answered, Kolo Mary. After Kolo Mary, we have I have more questions. Kolo Mary, let's see. The next question is from Pluto Cycle. Is there any chances of my uterus damaged? Why do you feel that your uterus is damaged? The only way you can get sure to know if your uterus is damaged or not is to see the doctor. Probably the doctors are going to ask you to do a scan. But for you to say if there are any chances of your uterus being damaged, then it is something you need to see the doctor about. Maybe you're suspecting, maybe something happened, maybe you're having bleeding, maybe you're having just maybe. But to be sure of what is actually happening in regards to your uterus, which is your womb, it is very important for you to see the doctor. All right, I hope that is clear, Pluto Cycle. Then, okay, Okay, I want to know my safe and unsafe days. Aina, I think I've answered your questions. I've talked to you about your safe and unsafe days. Hello, Anthony Yosemeka. Thank you, and thank you for joining our live. Amazing Grace TV said hi. Hello, Amazing Grace TV. It's nice having you on our live. Aina, like I don't want to miss anybody's question. Colomary said hello. Colomary, I think I've replied your message. So read Jesus speaking said, my period is not flowing well like before. What is the cause? And secondly, my period is very light and slimming. I need help. So when you say your period is not flowing well, what do you mean? Aside the fact that it is light and slimming, what do you mean? Does it mean that it was flowing for 4 days before? Now it's just 1 day, or it's just 2 days, or it was flowing for 7 days before and now it's just 6 days or 5 days? What do you mean? Read Jesus speaking. I would really like to know what you meant by that. Read Jesus speaking, please. I would like to know what you mean by that when you say my period is not flowing well like before. Did you lose weight? Yes. Did you lose? That's a question you should ask yourself. Did you experience weight loss? Because when some people they lose weight, they were fat before, all of a sudden they lose weight, or they were exercising or doing one or two things. That loss of weight can cause a change in their period, can make it slimmy, can make it lighter than it usually be. And also stress can actually affect your period, making it lighter and making it slimmer. But one of the reasons why you could be experiencing that could be weight loss. Why you're experiencing that. And I would like to know when you say your period is not flowing well, what you mean. Read Jesus speaking. Let me know if you lost weight, and let me know what you are trying to from 5 days to 2 days. She said from 5 days to 2 days. The normal menstrual period is usually between 2 to 7 days. It's usually 2 to 7 days. All right. 2 is normal, 5 is normal. All right. What I would advise you to do, if you are concerned, see the doctor. But if you are worried about the slimmy and lighter period, it could be as a result of weight loss. It could be as a result of stress. It could be as a result of PCOS. So if you really want to know a definite answer to this question, I will advise you see a doctor to be more precise, I mean. So read Jesus speaking. I think your question has been answered. We have a Fosachi, thank you very much, and thanks for joining our live. We have Precious Gift said, what could be the reason why a lady will see her menstrual cycle for 5 days, then 1 week interval, another menstrual cycle for 3 days? That could be a medical condition that needs to be sorted out. It is not normal. So what I would advise you to do is to see the doctor, because you can't see your measures. If it's like 21 days apart, then perfect. But if it's 7 days apart, then you need to see a doctor. It could be as a result of endometriosis, it could be fibroid. I'm not saying it is, but to be on a safer space, I would advise you to see the doctor, because having a period 7 days interval, it's not normal. Precious Gifts, if your question has been answered and you heard this, drop on the comment section. So having a period between, like after 7 days, you see a period 5 days, and after 7 days again another period starts, then it's something you should see the doctor about. It's not something you should keep to yourself. All right. So we have Chidima Ezema. Please, what medication can you recommend to see cervical mucus during ovulation? Let me tell you something. If you are ovulating, you don't need medication to start seeing cervical mucus. All right. Some ladies ovulate and they don't tend to see that cervical mucus. You can actually check for other signs of cervical mucus. You can actually check for other signs of ovulation, like increase in body temperature, increase in libido too, because during ovulation there's an increase in libido. There's this high urge or high tendency to have sex with your partner during ovulation period. You can watch out for these little signs. I made a video on the 10 signs of, I think 10 signs on ovulation on my YouTube channel. So you can search for that video. It explains everything in details, where we talk about the various signs you should watch out for when it comes to ovulation outside cervical mucus. So check for that video, the various signs you should watch out for when it comes to ovulation, because that's going to give you a clue outside cervical mucus. Because some ladies actually have this cervical mucus, but it's inside the vagina. They hardly notice it most times. They hardly notice the cervical mucus. It's not like very obvious like for others. So first, as you said, Chidima, if your question has been answered, drop on the comment section and let me know your question has been answered. So we have first, as you said, I am eating noodles. Okay, eats very well. Repeating, I think I've answered that question. So Osho Zekai Victory said, I saw my period on day 3. I have a 28th cycle. I want to know my fertile window. Is it third, or when you say you saw your period on day 3, that I don't understand. Does it mean that you saw your period on the 3rd of July? Is that what you're trying to say, Victory? You saw your period on the 3rd of July? Be specific so that I will know. And are you sure you have a 28-day cycle? Do you know how to calculate it? Did you get the 28-day cycle and you are sure, okay, I have that 28-day cycle and I saw my period on the 3rd of July? Because if you saw your period on the 3rd of July, so you have to calculate 14 days from the 3rd of July, and that is going to give you your fertile window. So, and if you are sure of your cycle, it's 28. To know your fertile period, to know the days you are ovulating, you have to count 14 days from that day, plus or minus 2, and walk around that period to get pregnant if you want to get pregnant. Victory, let me know if your question is being answered. Precious Gift said, yes, my question has been answered. I think I don't want to mix up any question here. Read Jesus, okay, read Jesus speaking said, Ma, I don't know if I can have contact. Can have your contact. I really need to talk to you about myself. I have been to the hospital several times, but I'm not getting the real answer to my question. Ma, I don't know if I can have your contact. Okay, read Jesus speaking. If you are on Instagram, I will advise you send me a message on Instagram. Yeah, send me a message on Instagram and I will tell you how to book appointments with me. So that's what I have to say. Read Jesus speaking. Betel Samudamir said, and also the cervix becomes very soft. Yes, you are correct. There are different signs of ovulation. You can check that video. It's going to give you a clue. Read Jesus speaking. If you have a message, you can send me a message on Instagram. Then I'll tell you how to book an appointment. And let me know where you are sending the message from. Victory. Okay. How will I know my cycle? Like the calculation. Victory. To know. Sorry, we have Omara. Omara said, "How will I know my cycle? How will I know my cycle? Like the calculation, please. This is my calendar here, so I can help you calculate it if you can give me the figures. When I say to know your cycle, you need to be able to tell me the day your April menses started, April, May, and June at least, or if you have May, June, and July, the start date. That's going to help us calculate your cycle for you. So if you are watching this video and you've not been taking down your start date of your menses, what I would advise you to do from henceforth is that whenever your menses start, go to the calendar and cycle it. That day that you just saw that tiny blood, the first day you saw the tiny blood, go to your calendar and cycle it. So if you are able to give me 3 start dates, it will be very easy for me to calculate your cycle for you. So if you want me to calculate your cycle, like Ella said, I have a mini calendar here. So with this, I can help you calculate your cycle. All you just have to do is to drop the day your menses started, maybe April, May, June, July. Anyone, just drop it. It could be April, May, and June. Just drop the start date and we'll be able to help you calculate it. Betel Semudame, that's another sign of ovulation. Yes, you're right. Chidima said, yes, thank you, ma. Victory said, yes, ma. Read Jesus, okay, ma. Victory, yes, ma. Okay, it's like everybody's question has been answered. I think everybody's question will be answered, and I hope I've not missed anybody's question. If you know I've missed your question, kindly drop on the comment section. And if you are watching this live video and you have not liked this video, I've been talking for long now. All you have to do is to double tap the screen and like the video. Double tap the screen and it automatically likes the video. That's all you have to do to tell me thank you for actually talking and explaining. double tap the screen, like the video. And if this is your first time of coming across this channel, my name is Mercy Mary. I'm a registered nurse midwife, currently practicing as a registered adult nurse in the UK. And on this channel, we talk about health. Those questions that you are shy to ask your doctors, this is an opportunity for you to ask it. Those questions that your doctors might not have that time to explain in details, this is an opportunity for you to ask it. Then if I have an idea, I'll be able to answer it. But for personalized health advice, I would always advise you consult your doctor. All right. For personalized health advice, I will always advise you consult your doctor, because this is more or less like a general knowledge, a general advice, but not a personalized advice per se. I don't know if I'm making sense by what I'm saying. To all those that have liked the video, thank you. And if you've not subscribed, all you have to do is to subscribe to our YouTube channel so you get notified whenever we upload a particular video. Tomorrow we'll be getting a video, hopefully tonight. It's to 11. Hopefully tonight or tomorrow you'll be getting a video where I'm going to be talking about the men. This particular video that I shot is going to be talking about the men. I mean men that are having testicle pain. So if you are a woman watching this video and your husband has complained about testicle pain, when I upload this video, kindly copy and share it to your husband, because it's for the men. And if you are a man, you've complained of testicle pain, or you want to know what you should do if you have testicle pain, I think you should watch, all men should watch this video that will be coming up. So that's why it's very important for you to turn on that notification button and subscribe. So immediately the video drop, boom, you have to be the first to watch it. And don't forget to drop on the comment section that you are the first to watch it or you are the second to watch it. I would like to see that in the comment section anyway. All right. So if there's any question, kindly drop on the comment section. Drop it below. We are here for you tonight. That is why I am here. Rich Jesus Speaking said, Ma, please talk about low sperm count. I think this low sperm count, we've done a live section on low sperm count. But because these questions keep coming, I think it's something we need to talk about. Like, I need to make a full video explaining what low sperm count is. When we talk about low sperm count, I did a live section and it's how do I explain low sperm count? Okay, if you are watching this video and you want to know about low sperm count, don't leave. Let me explain it in details. Don't just leave, just wait. Let me explain it in details. You see low sperm count. If you have a syringe, you see, like when the nurses withdraw, I'm talking about 1 ml, very small. In that 1 ml, when a man ejaculates, releases, they take 1 ml of that ejaculate. That ejaculate is not just sperm, it is called semen. It is called semen. So if that semen, the amount of sperm inside that ejaculate, that 1 ml, is less than 15 million sperm, then you can hear them saying, oh, this man has a moderate sperm count, it has a low sperm count. All right, you can hear things like that. Oh, the man has a low sperm count. If it is less than 50 million sperm in 1 ml, then that man has a low sperm count. And when a man goes for semen analysis, they are not only checking for the sperm count, they are also checking for the shape. They are also checking for the movement. How does this sperm move? Because you might have the 15 million sperm. Are the sperm even moving? Are they moving? Because if they are not moving, they are not going to get to the eggs. If they are not in the right shape, they cannot enter inside the egg. So when they go for semen analysis, they analyze the sperm of the man. And when it comes to low sperm count, it is difficult for them to conceive. It's a risk, it's a dicey thing. So people might conceive with low sperm count, but when a man has low sperm count, it puts them at risk for infertility. So that is why in the previous live where I talk about low sperm count, I emphasized on the benefit of having food rich in zinc, having food rich in omega-3. Bananas are good for men. They are good for their sperm health. Spinach, they are good. Green leafy vegetables, they are good for men's health. Nuts, granules, walnuts, almond nuts, all these are good for men's sperm. I've explained this in my previous video. So in our previous life, I said that as a man, instead of you to be taking alcohol, instead of you to be taking caffeinated drinks, instead of you to be taking soda, you can replace those things with smoothies. Smoothies made of bananas, spinach, nuts. It's going to help your sperm health. And if there is a need for supplements, your doctors might advise you take supplements to help boost the sperm health. So that is what I have to say, and I hope it helps. Read Jesus speaking. Emmanuel Obina, I didn't see your question. There's something you people should know is that if you put any question that has some sexual language in it, YouTube might not allow it to appear on this live video. So if there's a way, if it's something very important, if there's a way you can modify it for me to see it. So Emmanuel Obina, I didn't see your question because I have answered everybody's question I have seen so far. So we have Bumi Omotoye said, I finished my period on the 11th of this month. Please, when is my ovulation? Bumi, to know your ovulation, we don't need to know the day you finished your period. Actually, we need to know the day you started your period, the day you went to the toilet and you saw blood in your pants. That day, that's the date we need. That's the day you started your period. So that is the particular day we need to calculate your ovulation. And the start date is not just for 1 month. We need at least 3 months start dates. Since we're in the month of July, if you can find the start dates for April, May, June, or even July, because we've gone far in July, then we can help you calculate, we can estimate your ovulation date. But if you can't find the start date, it's going to be difficult for us to estimate your ovulation. So Betelo Semundiame said, can low sperm count cause miscarriage? No. I've not heard about low sperm count causing miscarriage. Now, I've not heard about low sperm count. If the egg is fertile, then it's good to go. Bridges speaking said, I've been married for 2 years now, but I've not been able to conceive. If you've been married for 2 years and you've not been able to conceive, it's time for you to see either a fertility expert to help out. And I would like to know if you have an idea of what your cycle is, your menstrual cycle. Do you understand it? Do you understand your safe days? Do you understand your fertile days as a lady? And also, if you understand this, is your cycle regular? Are you seeing your menses every month? If you are not seeing your menses every month, that's kind of a red flag. That's kind of a red flag to you getting pregnant. If you are not seeing your menses every month, you are having irregular cycle. You are having irregular cycle. That is a red flag when it comes to getting pregnant. So these are the questions we need to ask. Are you seeing your menses every month? Is your cycle regular? Do you understand how to calculate your cycle? Do you know your ovulation dates? Have you tried having sex on your ovulation dates? Even if you have tried having sex on your ovulation date, have your husband done semen analysis? Have they checked his sperm count? Is it okay? All these questions are what we need to ask to be able to help and guide you through. But in all, if you've been trying for 2 years, it is high time you see the doctor or a fertility expert to actually put you through on what's next to do. So that's what I have to say. Read Jesus speaking. So Bangura said, hi, Bangura, how are you doing? And trust you are doing great. Boom, your motto, you said 7. You started on the 7. Like I earlier said, Bumi, it's not just one day we need. We need the start date of 3. We need the start date of 3 menses. April, May, June, or May, June, July. For you to be able to get an estimate of your ovulation day, we need a start date of 3 months. So if you have no idea, this is the time for you to start now. Whenever you see your period start, go and cycle it in your calendar. We will need at least 3 months to be able to help you calculate your fertile period and your non-fertile period. So we will need at least 3 months, 3 months start dates to be able to do that. So I hope that is cleared. Omotoye. Emmanuel said, my wife do have pain after we meet. Please, why? In terms of pain, is it after or during? If it's after, it could be something she needs to see the doctor about. You get? Because in my previous video, in my previous live section, I explained in details, if you can watch it, I explained in details the various causes of pain, like during sex, the various causes of pain, why women experience pain during sex. This pain could be internal and this pain could be external. So you have to find out from your wife, is this pain on the outside or inside of me? Like, is it inside of her or is on the outside? This is a question you need to ask your wife. Because most times when it is outside, the pain is on the surface, it's usually as a result of some STIs or UTIs. But if it is inside, it could be as a result of some medical conditions that needs to be treated. So you have to ask your wife what kind of pain, where is the pain located? And if the pain is getting worse or it's serious, it is very important for you to see the doctor and make your complaints to the doctor. So that's what I have to say, Obina Emmanuel. And I hope that helps. If you don't understand what I said, if the grammar is too big, just let me know. I'll try and see how I can break it down to understand better. So let me know if you don't understand. I'll try as much as possible to break it down so you understand better. So that's what I have to say, Obina. So AJ TV Nice said, good evening, sister. Good evening, AJ TV Nice. Rich Jesus speaking. I'm seeing my period every month. If you are seeing your period every month, that is a sign that you are actually ovulating. That is a sign that you're ovulating. So it's just for you to track down your ovulation. It's just for you to track down your fertile period using your cycle. That is going to go a long way to help. AJTV said how to get a baby boy. I think I've made a video about how I was able to do that. But like I earlier said in the video, it is not 100% effective. But you can give it a try. You get, when it comes to giving birth to a baby boy, some research says that having sex on your ovulation day, that's the day you release egg as a woman, having sex on that day increases your chances of giving birth to a baby boy. Why? Because the sperm actually runs faster. The male sperm, that's the boy's sperm, actually works faster. Just that they die on time, but it works faster. They tend to get to the egg on time. So having sex on the ovulation day, the day you are releasing the egg, kind of increase the chances of you giving birth to a male child. So that's why. But if you want to understand better, I have a video on that. You can watch it and see how it goes. Like I earlier said, and I'm still saying, it is not 100% effective. And also, every child is a blessing. So that's something you should do. So Emmanuel Obina said, inside man, inside pain could be like when your wife is having pain on the inside after sex. It could be as a result of fibroid, it could be endometriosis, it could be PCOS, it could be different medical condition. So what I would advise you is for her to see the doctor. Yes, don't take it as something small. Let her see the doctor. Let her just go for a proper checkup. It's very important. Yes, you might be thinking it is just pain, but it is important for her to see the doctor to get it checked out. Though some pain during sex might be psychological. Like in my previous life, I explained the psychological aspect of pain. Like it's not medical, it's not an XTI, it's not an UTI, but it's psychological pain. Like you just see women experience psychological pain. Sometimes maybe a flower or some cash might make those pain go away. Yeah, like maybe some more romantic dinners can make the pain go away. Yes, but if it is not psychological, you believe everything is going on well with you people, like the marriage is super duper, everybody is happy, but yet you keep experiencing the pain on the inside, then I would advise you to see the doctor. Let them just get her examined and see if there's anything. So that's going to go a long way to help. So Emmanuel, I don't know if that answers your question. I don't know if that answers your question. Riches us speaking said, Ma, anytime I meet my husband, once I stand up, the sperm will leak out, and it looks foamy. What could be the cause? In terms of sperm leaking out of the vaginal, I think when it comes to sperm, it's normal. I think that happens to most women. It's normal for the sperm to come down when you stand up. Something goes up, anything that goes up is likely going to come down. But one thing you should know is that after ejaculation, after sex, the sperm that wants to get to the destination, they've already gone to their assignment. So what you are seeing that's coming down is just the remnant. So leaking, like sperm coming out of your vaginal after sex is normal. Sperm coming out from your vaginal after sex is normal. But if your husband is having something like a watery sperm, you can advise him to go for semen analysis. You know, generally men are skeptical about you telling them, oh, go for semen analysis, go check it out, especially like in the olden days. But I think now men are getting more exposed, they're getting more knowledgeable about these things. So you have to do it systematically, do it like calmly, tell him, oh, since we have been trying to conceive for the past 2 years, why don't we go for checkup? Why don't we try to see what is the cause? Why don't we do some semen analysis and I check myself and see, since you are ovulating, it's a high chance that you are fertile. It's actually like there's a higher possibility that you can carry a baby. Because if you are seeing your menses every month, it's a sign that you're ovulating every month. You are releasing egg every month, and your eggs just need sperm. So you can talk to your husband calmly, have a conversation with him, and suggest saying going for semen analysis. So just suggest with him, let both of you should go for, like, he should go for semen analysis, but say it calmly. You get, say it calmly. It's not something you like, oh, you are the reason why. No, like it's something both of you want. It's very important you people talk about it calmly. It's very important for you to talk about it. It's not just like putting the blame on him or something. No, I'm not saying his sperm count is low, but just advise him to do a sperm count analysis. And why doing that sperm count and why doing the semen analysis, also try and encourage him. If he smokes, if he drinks, tell him not to smoke again if he can, especially when both of you are planning to have a kid. Tell him to stop smoking if he can. Tell him to stop drinking alcohol if he can't. And also check out his work. What kind of work is he doing? Is he working in a situation where he's always sitting down for long? Is always sitting down for long, or he's working in a place where there's heat. Heat is always hitting the scrotum. Okay, if heat is always hitting the scrotum, then that could affect his sperm count. So you can also tell him about that. I don't know if I'm making sense. Read Jesus speaking. So he said, yes, ma, it's watery. If it's watery, like I earlier said, let him see a let him go for semen analysis. Sorry. Read Jesus speaking said, gynecologist said my eggs are not matured. I don't understand that aspect. Okay. So immature eggs in the ovary, they are usually called oocytes and can result from different factors, such as hormonal imbalance. Did the doctor talk about you having hormonal imbalance? Like it could be genetic, it could be your lifestyle. Your lifestyle. How are you living your life? What are you eating? What are you doing? Are you smoking? Are you drinking? It could be your lifestyle too. Like your eggs are not mature. When your eggs are not mature, the sperm cannot fertilize it. Did you ask the doctor, what can I do? When the doctor told you, my eggs are not matured, I think the best thing you should ask him is, what can I do? And why is the egg not matured? Is it as a result of PCOS? But from what you said you are seeing your period regularly. So you have to find out if it's PCOS, if there's ovarian failure, if it's a genetic factor, if it's a hormonal factor. You have to find out the cause of that immatured egg, why your eggs are not matured. You have to find out why. There's going to be a reason for it. It could be genetic, yes. But I think you should ask the doctor further questions to find out why your eggs are not matured. And there's something I really want us to know as people, as individuals, we should always be inquisitive about our health. When the doctor tells you this, try to say, doctor, please. Like if it means saying pigeon, like be humble. Say, doctor, please. I will be sincere with you. I don't really understand this thing you are talking. Can you break it down for me? You don't have to hide how you feel. You get, because you are paying the doctor for your health care. So the doctor has to give you useful information in regards to that. You say, doctor, I don't understand what you just said. You said my eggs are not matured. What is the cause? Because personally, I cannot pinpoint the cause of your matured eggs because I am not the doctor that actually reviewed you. Like I earlier said, matured egg can be as a result of PCOS, it can be as a result of hormonal imbalance, they can be genetic, and they can be as a result of your lifestyle choices. So you have to find out what is actually causing the eggs not to mature. All right. And also find out from the doctor, okay, since you said my eggs are not matured, what is the way forward? I don't know if I'm making sense. Read Jesus speaking. Just let me know in the comment section. Margaret Bangura said, I would like to conceive twins, a male and a female. How could it be possible? I think in some countries it is possible. It all depends on your country and the rules applies to your country. There are some countries where the doctors actually give you some medications to stimulate your ovaries to release egg. Most times they don't give it to women that give birth naturally. They give these medications to women that are finding it difficult to actually conceive. They have been trying, it's not working. So they give them this medication to help stimulate their ovaries to release matured eggs. All right. So when they stimulate their ovaries, the ovaries release more than one egg at a time. So the ovaries might release 2 eggs, 3 eggs. And when the sperms come, it fertilizes both eggs and a twin is being formed. So these twins are usually fraternal twins because it's 2 different eggs. All right. So if you want to conceive a twin, the best thing for you to do, I'm not a fertility expert, I'm not a gynecologist, and I'm not allowed to like give personalized advice. So check out what is legalized in your country. There are some countries they don't do gender selection. So if you have the money, you can do IVF and pick. There are some country it is legalized, so you can pick the gender you want. There are some country they don't allow you to pick the gender. They don't want allow you to pick the sex of the baby. So it all depends on your location. It all depends on what that country is offering at that particular moment. Like Ella said, some country are like they listen to what you have to say. They give you some drugs easily. You can easily get those drugs easily. You can easily get those drugs prescribed for you. You take it and your eggs are being stimulated and they release these eggs and they get fertilized. Why in some countries it is not like that. So find out what works in your country and also see if you can get these medications. If the doctors can give you these medications, they can prescribe some Clomid. There are some medications that can prescribe. I think you've seen a lot of things about Clomid on social media helping to stimulate the eggs. But I will always advise, always consult your doctors before you take those medications because some of these medications can actually stimulate things in your body. All right. Some of these medications can actually stimulate things in your body that you don't like. So that's why if you consult the doctor, they do proper examination before prescribing these medications for you. So I don't know if I've been able to answer your question, Bangura. Bangura, let me know if your question has been answered. Omotoye said, can someone be ovulating without any discharge? Yes, some people don't even notice that they are ovulating. They don't even see any discharge. They don't see it. They don't see that slippery, slimy discharge. They don't. Why some? It's just obvious. They see it. They just get wet easily during that period. And penetration during that period is usually very easy. Like for some people, it's obvious. So if you don't really see that discharge and you notice that when having sex, penetration is easy, that could be a sign. Penetration is easy, you are easily wet during that period, your libido is high, that could be a sign you should look out for. And there's something, like I earlier said, I have a video on the various signs of ovulation in a woman. So you can watch that video. It analyzes the various signs. That video is going to help you a lot. So Emmanuel Obina said, can a woman give birth naturally after CS? It is possible, but most doctors will advise you to go for CS since the first baby is CS, cesarean section. But it is very, very possible for a woman to give birth naturally after cesarean section. It is possible. And it's possible. I've had situations where a woman gave birth through CS with the first baby. Then the second baby, she was skeptical and she was like, I want to deliver the second baby through cesarean section. So the second cesarean section was booked. Like it was booked on this particular day, go for the hospital, the baby will be taken out. But before the cesarean section, the woman went into contraction and delivered before anybody could see it. Like delivered quickly, as if it's normal. So it's so possible for women to give birth naturally after cesarean section. So cesarean section doesn't like, but most doctors will advise, since the first one was cesarean section, they will ask for your opinion, and if you really want to go for cesarean section again, they might opt for it since the first one was cesarean section. So it's possible, but it all be, and also it depends on a lot of things. How big is the baby? Yes. So if you have a bigger baby, you can't actually go for natural births after having cesarean section. If there is a big baby, if your baby is very big, they did scan and the doctor tells you your baby is big, then I will advise you not to risk it. The best thing to do is to go for cesarean section. There are different reasons why your doctors will advise you to go for cesarean section to save your life and that of your baby. And one of the reasons is a big baby. One of the reasons is if the baby is in distress. So all these things are something we should take note of. Who asked that question? Emmanuel, is your question answered now? Okay, Jesus speaking said, Ma, is there any medication that I can take that will enhance my libido? I hardly have urge for sex. There's something I want you to know, Jesus speaking. When trying to conceive, like you said, you've been trying for 2 years, our mind gets disturbed. Our mind gets worried. Like whenever we have sex, we feel that we are having sex because of the child, because we want to conceive. So our mind is disturbed. I'm talking about ladies that are trying to conceive. So their mind is no longer settled because whenever they have sex, they just want to do pregnancy tests after 2 weeks. So one thing I would advise you to do is to take, I know it is not easy because I am not the one wearing the shoe. It's much easier to give advice than to take it. But this is my personal advice to you. First of all, you have to remove the mind that you're having sex because you want to conceive. You have to put it in mind that, okay, I want to have sex because I want to have fun. You have to have that mindset that, yes, sex is fun. I want to have it. I want to have fun with it. Try as much as possible not to always program your mind that, try as much as possible not to expect something from sex. Try as much as possible not to expect like your next pregnancy test after sex. Try and free your mind. That's going to go a long way to help you. And eating healthy, like I always say, goes a long way to help with your sexual urges. Eating healthy goes a long way to help with your sex life. What are you eating? What are you actually eating? And as a married woman, you have a lot of things going through your mind. If you want to have sex, I think you should dump those things, dump them somewhere else. Empty your mind, fill your mind with positive things, fill your mind with something crazy, fill your mind with something lightened. No need to think about things that are bothering you. No need to think about getting like having a baby at that particular moment. See yourself like you want to have fun. I think that's very important because most times in the parts of the country where we are from, they see sex as something like the only reason why a woman should have sex because she wants to have a baby. You get? They feel that men are the only ones that should enjoy sex. You as a woman should program your mind that this is something I want to feel. This is something I want to enjoy. Because it's actually good for your mental health. When you enjoy it, good hormones are being released in your body. You are happy, you are excited. You get? So sometimes you don't need medications. Even if you take medication, sometimes those medications are not going to work because your mind is already programmed that I'm having sex because I want a baby. Okay, so you having a positive mindset, having a good conversation with your partner, let them know how you feel is going to help you. So it all depends on the partner you are having. Have a conversation with them, reduce your stress level. You understand? Always set out time for intimacy for your partner. It's going to go a long way to help. All right. And I'll still talk about this to women. Women out there, you have kids, you have a lot of things, you have thousands of things to think about. You are thinking about your kids, you are thinking about the school lunch, you are thinking about school runs, you are thinking about the lunch pack. You have a lot of things to think about. Your mind is filled, your mind is clustered. But if you want to have sex, you have to remove those lunch pack from your head. You have to remove everything from your head and program your mind that you are here to have fun. And if you're having sex, don't feel guilty about it. Don't have the mindset that they would think I'm a whore, they would think I'm a prostitute. No, you are in your partner's house. You should have sex with the mindset I'm here to enjoy it, shikina. So because if you continue to have that negative mindset, it's indirectly affecting your sexual urge. Okay, so that's what I have to say. I don't know if that helps. Read Jesus speaking. Let me know if it helps in the comment section. So we have a Bumi Omotoye said, after giving birth and the person is not breastfeeding, when can she get pregnant again? It's very quick. It's very quick. It's very quick for her to get pregnant again. Because if she's not breastfeeding, she could ovulate. And the funniest thing is that most people will say, oh, I'm not seeing my menses, but I'm pregnant again. Yes, that's because ovulation happens before menses. Before you see your menses after giving birth, you have to ovulate. Before you see your menses after giving birth, you have to ovulate. So that's why you see some people say, I didn't see my menses after giving birth, but I am pregnant. That's to say that they were ovulating and they didn't know. So they had sex on that day and they got pregnant. So if you are not breastfeeding, it is very quick for your menses to start. And it's also very quick for you to start ovulating. And when you start ovulating, you have sex, definitely pregnancy is already knocking on the door. So you all have to be careful. Like in the UK here, when you are leaving the hospital, they ask you this question. Are you not thinking about any family planning options? They always ask. I don't know if they all, but me personally, I've been asked during my first child, they asked me about, do you have any family planning option method you want to use? My second child, they asked me if I have any family planning option method I am interested in, because they feel that even breastfeeding is not 100% safe. Breastfeeding is not 100% a family planning method because anything can happen at any time. So if you're having sex after delivering, get ready to get pregnant because you don't even know your ovulation. So that is why you see people super excited, like when they see their first menses, at least give them clue that, I started ovulating, I have to be careful. All right. And when they've not seen their menses, they are a bit skeptical about sex and all that. So that is that. I don't know if I've been able to answer your question, Bumi or Motoye. Let me know in the comment section. So Riches Us Speaking said, thanks, Ma. You have really made my day. I am glad I've been able to make your day. I just want you to be cheerful. I just want you to remove your mind from, oh, I'm having the next sex or a baby. No. Like, have fun. Life is too short to worry. Have fun. You should have fun while your husband is having fun. He should not be the only one having fun while having sex. So remove all your worries and program your mind on having fun. That's the best way you can live healthy. That's the best way you can actually like release the good hormones. There are a lot of good hormones in our body, and sex is one of the ways for you to release those good hormones. A lot of women are depressed out there because they don't really enjoy sex. They see sex as a big work. They see the sex as something that they have to do. They see sex as something that it's in my roster, I have to do. They get scared, they get worried, they have a lot of things to think about. I think it's very important for women to prioritize themselves and also enjoy sex, because once both parties enjoy sex, I say both parties are definitely going to be more closer to each other. Intimacy actually builds, like, couples that have sex regularly and enjoy the sex. It's not just to have sex regularly and enjoy the sex, tend to last longer. That's my own theory, Sha. I don't know if any research has been done. So Claudine said, God bless you. You're welcome. So Richardson Speaking said, my last question for the day is, my stomach hurts me every day. And once I am feeling the hotness inside, it also gets hot outside. What is the cause? When you say your stomach is hot, I don't really understand that. When you say your stomach is hot, I don't really understand that. I don't understand that particular line. If you can break it down a little bit, hot. And if you're watching this live section and you've not liked the video, I don't know what you're waiting for. Kindly click I like, double tap the screen and it automatically likes the video. That's one. Double tap the screen and it automatically likes the video. And if you've not subscribed to our YouTube channel, kindly subscribe to our YouTube channel, because on this channel, we talk about health. We talk about fertility. We talk about sexual and reproductive health. All right. Like I always say, I'm not giving you personal advice. This is just like a general thing, but always consult your doctor for personalized health advice. Okay. In my wish is that a lot of doctors and nurses out there should also come out and speak about this interesting aspect about our life, which is sex and reproductive health. Because a lot of people are going into depression because of this topic. They are scared to ask, they are scared to speak out, they are scared to say what they feel. So my wish is that a lot of nurses and doctors should come out and say it with boldness and not be shy. They should be bold enough to say it. They should not be shy. That's my wish. I feel hot inside my stomach. Okay, I would just see it as hotness. Sometimes it can be as a result of indigestion. It can be as a result of indigestion. It can be as a result of peptic ulcer. It can be as a result of gastritis. There are different reasons why your stomachs are going to feel hot. They are going to cause you discomfort. So this is something you should also see a doctor about, because if you are feeling hot, you check a temperature too and see if there's an increase in body temperature. It's something you should see a doctor about too. Yes, you heard me right. Because it could be the indigestion, it could be gastritis, it could be acid reflux, it could be peptic ulcer. There are different reasons. There are several reasons why your stomach could get hot. All right. So you can see a doctor in regards to that to get it checked out for you. I hope that helps. Bumi said, after giving birth and my first period started on the 7th of this month, when is my ovulation? I can't really say. I can't really say your ovulation. We need to know at least 3 start date of your period. So you have to be careful. Right? I can't really say when your ovulation is, because we need to know at least 3 start dates of your ovulation to be able to know your ovulation day. I don't know if that helps. We can't predict your ovulation, because to be able to predict your ovulation, we have to know your menstrual cycle. And to be able to know your menstrual cycle, we need at least 3 start date of your period. So you have to cycle today's on, which you've cycled the month of July, which you've started already. July, August, September. With July, August, September, we are able to know, okay, when is your safe period, when is your ovulation period, when is your unsafe period, when is your fertile period, and when it's not your fertile period. So, Bumi, I hope your question has been answered. Why is my period delayed? Okay, why is my period delayed? There are different reasons why your period could be delayed. We've made a video on this YouTube channel on the various causes of delayed period. You can actually check our YouTube channel for that particular video. But here are some reasons why your period could be delayed. As little as stress. You heard me? As little as stress. When you are stressed out, it can actually delay your period. Ask yourself, did you take Postino 2? Did you take emergency contraceptive? That can delay your period too. Then ask yourself, did you treat malaria recently? Did you take paracetamol recently? Did you take ibuprofen this month? Are you on any medications? That can actually delay your period too. Ask yourself this question. What should you ask yourself again? Did you treat infection recently? That can delay your period. Okay, there are several reasons why your period can be delayed. And also, are you pregnant? If you are pregnant, that can delay your period. That can stop your period temporarily. So that's that. I don't know if that helps books and crafts, but to get more detailed explanation on the causes of delayed period, we have a video on our YouTube channel on the various causes of delayed period. So you can actually watch that and stay informed. All right, books and crafts, let me know if you got the answer to your question. My temperature will be hot, especially my tummy. See the doctor, read Jesus speaking. Don't take things like that lightly. I will advise you see the doctor. I will advise you see the doctor. Stress and anxiety can cause it. Maybe you are stressed out. You are thinking too much. You are worrying too much. That could be the reason. No jokes. That could be the reason. Read Jesus speaking. Are you taking any painkillers? That can alter your cycle too. I've been talking for the past 1 hour. There's something I like. Whenever I come live, I see a lot of questions. I'm happy. Yes. Yes, people come, they ask their questions, they get answers, and they go. I am super happy. I am super excited that that I have a lot of questions, because it simply means that I am helping a lot of people. It simply means that a lot of people are benefiting from the live sections. So I'm super excited whenever I'm coming live and I'm seeing questions. Thank you all for asking asking your questions. I'm super excited to do this over and over again. So Chidima said, please, when do you usually have this live stream? In terms of the actual time my live stream starts, it's usually a dicey one. It's usually between 9 to 10. It could be past 10, because like I earlier said, I have a 6-month-old, which I'm still trying to sleep train. So he sleeps between 9:30, 10. That's the only time I can get. Then I'm able to get ready for my live sections. So what I would advise, program your mind that between 9 p.m. to 10 p.m. I'm going to be live. Then what you need to do is to subscribe and turn on the notification bell. So once you turn on that notification bell on YouTube, whenever I'm on live, you get notified immediately and you join. So subscribe, turn the notification bell, and whenever I'm live, you get the notification as soon as possible. All right. So that is that. So we have Boots and Craft said, oh, it's a lot of questions. Boots and Craft said, I am not pregnant and I don't take any medicine and I don't take any pills, but I think I'm stressed because last week I cried a lot. Oh, why are you crying? Are you trying to get pregnant? And would you like to share with us why you're crying? Would you like to share with us your pain? It's actually a safe space here. We are here to share in your pains and we're also here to share in your joy. Is this something you would like to talk to us about? Why have you been crying? Why are you stressed out? Do you want to get pregnant? Do you know a cycle? Is this something you would like to share with us? I'm supposed to end this live, but if I am going to wait, if you okay said no, I cried because I am broken hearted. Okay, sorry. Okay, you're broken hearted. It's normal to be broken. Like I think heartbreak is kind of common these days. But is it a heartbreak like what caused the heartbreak? I don't want to assume what my head is telling me. But would you like to share why you got the heartbreak? Why your heart is broken? So we know. Because there are different reasons why people's hearts are broken. It could be relationship, it, it could be work wise. What in particular made your heart broken? Is this something you would like to share with us? Like I earlier said, it's a safe space. I can give some help if I can. All right. Because a lot of things are happening these days. People are passing through a lot emotionally, mentally, and physically. People are passing through a lot. It's not been easy. A lot of things are happening around the world. Economic meltdown, inflation, everything is happening. So a lot of things can break your heart. If it's something you would like to share, I'm going to stay longer on this live and listen to what you have to say because I'm supposed to end the live now, but I'm just going to give you some time to express yourself in the comment section. Then I'll see what I can do to help if need be. So let me know in the comment section, Book and Crafts. Book and Crafts, let me know why you were heartbroken in the comment section. And if you are watching this live section, you've not double tapped to like the video, just double tap on your screen. Tap the screen twice. It's going to automatically like the video. Just tap the screen twice. Pam, pam. It automatically likes the video. So that's going to go a long way. And if this is the first time of coming across this channel, I will advise you to subscribe. I will advise you to subscribe and turn on the notification bell. Book and Craft said, I don't want to share it. And thank you so much for your sympathy. Okay. You're welcome, Book and Craft. I sincerely wish you all the very best. And I want to let you know that don't expect too much from life. One, don't expect too much from life. Don't expect too much from people. If you don't expect too much from life and you don't expect too much from people, it makes your life more better. Because sometimes most of our heart breaks, most of our pains as a result of the fact that we expect too much from life. We expect too much from people. We trust too much. We actually I don't know how to put it, but please and please try as much as possible to focus on you. Yes, you don't have to be hard on yourself no matter what has happened. I don't know really what really happened, but please and please don't be hard on yourself. Take life one day at a time. Take life one day at a time. Don't expect anything from anybody. Yes, it's good to like, okay, I sent a package, I'm expecting it. That's a different thing entirely. But I believe you understand the concept I'm coming from. Don't expect things from, like, don't expect too much from people. Don't expect too much from the world in general. Life has its own ups and downs. Life has its own tribulations. Life has its own trials. But one thing I will tell you is that try as much as possible to bounce back. I'm going to share with you how I deal with pains and how I deal with things that affect me. Yeah. Personally, I've had my own fair share of life. I've had my own downside of life. There's something I usually do. It looks crazy. Yeah, it looks crazy. But this is what I do. I slap myself. Yeah. Whenever I tell my siblings this, they're like, why? Yes. I slap myself to reset my brain, not to stay in that pain for long. I slap myself to reset my brain, not to worry too much about things I cannot control. I slap myself to bounce back immediately. You get, like, I've had a fair share. I just had to slap myself and tell myself, Mercy, it has happened and it has happened. The next thing on your mind should be, what is the way forward? Because thinking about the problem doesn't solve it. Like worrying, crying, like killing yourself about a particular problem does not in any way solve it. You can cry from now to tomorrow, it doesn't solve it. That's just the reality. You can you can scream from now to it doesn't solve it. But it's okay for you to cry at that particular moment. But you have to reset your brain that it has happened. What is the way forward? Life is not fair. Life is full of a lot. Life comes with its up and down. Don't feel like life is going to be straight or true. No, it can never be straight or true. You have to program your mind that way. Life can never be straight or true. It can never be a straight road. It's not possible. Life cannot be a straight road. You are going to get corners. You're going to get bends. You're going to get slapped. You are going to get shocked. You are going to get disappointed. It's life. As far you are in this life, your life is going to deal with you in its own way. But one thing you should tell yourself is, no matter how life deals with me, I am going to bounce back. When it happens, tell yourself it's life. What's the way forward? I know it's easier said than done. Yes, it is easier said than done. But you have to ask yourself, the deed is already done. What is the way forward? The deed is already done. What should I do next? I can't change it. The deed is already done. What is my plan B? If you don't have plan B, start making plan B. The deed is already done. What should I do? So it's not time, because if you ponder, you cry for weeks, you cry, it's not going to change anything. Like I earlier said, it is easier said and done. Let me share a story. Like before I became a nurse, like as a young student in the university, I got my heart broken a day before my professional exams. Imagine that, getting your heart broken a day before your professional exams. What did I do? As usual, I used my coping mechanism. I gave myself a hot slap. I said, Mercy, you can't lose two things at the same time. You can't lose your boyfriend and also lose your professional exams. It's not possible. You must be stupid, Mercy. I mean, I'm not talking about I'm not talking about imaginary slap. I mean real slap. I slapped myself on the face and told myself to wake up. I have an exams to write. I have my career to pursue, because I can't lose two things at a time. That's a slap on my part. So I had to wake up to reality that it has already happened. Mercy, what is the way forward? The earlier you start programming your mind that shit happens in life, the better for you, the better for me, the better for all of us. It's just life. Life has its way of dealing with us, but we have to bounce back. Because if we continue to rely, like put pressure on ourselves when things don't happen to us, trust me, that's all I have to say anyway. I think I have to stop it here. But I wish you all the very best, and I pray you bounce back as soon as possible. That's my innermost heart desires for you, because I know life has a way of dealing with us differently. So let's go. Let's see. I'll just take a few questions, then go. I'll just take few questions and go. Few questions and go. Michael Isama said, when I have cough, I do breathe high. What should I do? What is the cause of the cough? Have you treated the cough? Like, what is the cause of the cough? When I have cough, I do breathe high. Like, are you having fever? Are you coughing out some sputums? Like, is a cough causing discomfort? These are the things you need to ask yourself. If the cough is that serious, I think it's high time you see the doctor for checkup. Okay? I think it's high time you see the doctors for checkup. So Michael Isma said hi. Hello, Michael. Claudine Otojagale. Really, yeah, I slap myself a lot. You have to move forward. Shit happens and life goes on. Life is not a bed of roses. Life is not a bed of roses. A lot are going to happen. Even the rich have their own challenges. The poor have their own challenges. The middle class have their own challenges. The girl flaunting designers on Instagram has his or her own challenges. So take life one day at a time. No pressure, no rush. Life is sweet. Enjoy it. So Michael Ismail, okay, said, okay, I think we've tried for today. We've done a lot for today. And I hope to see you all tomorrow in my next live video. Please and please, if you're watching this live, and you've not double tapped to like this video, what are you waiting for? If you're watching this live video, this particular live section, and you've not double tapped to like the video, what are you waiting for? Double tap your screen and like the video. All right, it's going to be a wrap from here, and I'm going to see you all tomorrow. Feel free to join our live. Feel free to share our live with your friends. Feel free to allow them come around. Feel free to allow them send questions. We are ready for you to take your questions. Remember, you're very important, and life doesn't have to be a bed of roses. There's a lot attached to life, but life is beautiful. Take it one day at a time. And my favorite song, let me sing my favorite song on this live section. I think books and craft question got me more emotional because I know a lot of people are passing through challenges. A lot of people are having a lot. There's this song I used to sing. I don't know if you're familiar with it. Before I end the live, it's like one day at a time. Like one day at a time, sweet Jesus. That's all I'm asking from you. Lord, give me the strength to do every day what I have to do. Yesterday's gone, sweet Jesus, and tomorrow may never be mine. Lord, teach me today, show me the way, one day at a time. One day at a time. Calm down. Tomorrow will be okay. All right, bye everyone, and see you in our next live tomorrow.